Hi, everyone, and welcome. Today, we're going to talk about a strange paradox that sits right at the heart of modern medicine. You see, we have these amazing, super effective treatments, but for some reason, they often don't work as well as they should. So, what's the missing piece? Well, it's not some new wonder drug or a fancy piece of technology. It's actually something much more human, the conversation between a doctor and a patient. So, let's start with the big question, right? Why do the best treatments, the ones backed by all the science, so often fail? It's a problem you could call the adherence bottleneck. It's that critical moment where all the power of a treatment just gets lost, somewhere between the doctor's office and a person's everyday life. So, where exactly does this breakdown happen? Well, it's usually not a problem with the medicine itself or the design of the therapy. No, the real issue is what happens after the prescription is written and the appointment is over. And here's the thing. Treatments fail because they have to fit into our messy, complicated human lives. I mean, we're all juggling jobs, families, stress, a million different things. And it's this human factor, all our personal challenges and motivations that ultimately decides if a piece of paper from the pharmacy actually becomes an effective treatment. And this is exactly where communication becomes so incredibly important. For the longest time, we've kind of dismissed doctor-patient communication as a soft skill. You know, something that's nice to have, like a good bedside manner, but not as important as the hard science. But a whole wave of new evidence is forcing us to completely rethink that old idea. This slide really lays out the huge shift in thinking. The old way of looking at it was, oh, communication is just a soft skill. It's about being polite. But the new evidence, it shows that communication is a powerful clinical tool. It's not secondary, it's fundamental to the whole process, and it directly improves how well patients do. So it's not just about being nice anymore, it's about being effective. Okay, so if communication is a clinical tool, how do you actually use it? Well, the answer is to start thinking about that clinical conversation as a form of coaching. And this isn't just some vague idea. We're talking about a specific set of evidence-based techniques, a coaching toolkit, if you will. So let's open it up and see what's inside. First step in the toolkit, we've got something called motivational interviewing, or MI. This is all about partnership. So instead of a doctor just telling a patient, here's what you need to do, MI is a collaborative conversation. The real goal here is to help the patient tap into their own reasons for wanting to change, which, let's be honest, is way more powerful than just following someone else's orders. Next, there's shared decision-making, or SDM. And it's pretty much what it sounds like. The patient becomes an active partner in their own care. The clinician brings all the medical facts and evidence to the table, and the patient brings their life, their values, what they prefer, what's actually realistic for them. And then together, they choose the best path forward. And finally, we have the building blocks of it all, patient-centered communication. You can think of these as the micro skills of clinical coaching. We're talking about simple, practical things like setting an agenda for the visit, really listening with empathy, and just checking to make sure everyone's on the same page. These small actions can make a massive difference. Now, this all sounds really good in theory, right? But you might be wondering, does any of this stuff actually work in the real world? Well, let's look at the hard data. This isn't about feelings or opinions. This is about what rigorous scientific studies have actually found. Let's start with motivational interviewing. The evidence here is just crystal clear. A huge analysis of the highest quality studies out there, we're talking randomized controlled trials, the gold standard in medical research, found that MI is a genuinely effective way to help adults with chronic diseases stick to their medication plans. And the benefits go way beyond just getting people to take their pills. MI doesn't just improve adherence, it leads to real, measurable improvements in health. Another meta-analysis, which is like a study of studies, showed it actually helps lower blood pressure. And for patients with heart failure, it helps them get better at critical self-care behaviors. So what about all those little micro skills? Well, another giant meta-analysis confirmed a really strong link between the quality of the conversation and whether patients stick to their treatment. But here's the real kicker. When you actually train doctors and nurses in these skills, their patients' adherence gets better. It's a trainable, improvable skill. This is so important. Good communication isn't some magical talent you're born with. It's a set of skills, things like empathy and planning together, that can be taught, they can be learned, and they measurably improve how patients manage their own health. We've seen it proven in studies on tough conditions like diabetes. All right, and what about making the patient a true partner? Let's look at the evidence for shared decision-making. A classic study on asthma patients gave us definitive proof. When patients were actually involved in choosing their treatment plan, they were way better at sticking with their essential medications compared to the old-school doctor knows best approach. The evidence, which is backed by super respected sources like the Cochrane Review, all points in one direction. When patients have a real voice in their own care plan, they are far more likely to stick with it. It's a simple idea, but it's also profound. Partnership drives commitment. So when you put all this evidence together, what does it all mean? Well, it points to a really fundamental shift, a new paradigm for how we need to think about the role of conversation in healthcare. If you take away just one thing from all of this, let it be this. Effective communication is not an optional extra. It's a core clinical procedure. It's just as essential as prescribing the right medication or ordering the right lab test, because it's the thing that makes the treatment actually work in the real world. This quote really says it all perfectly. These coaching skills aren't just supplementary add-ons. The research is clear. They directly influence whether a patient stays engaged and adheres to their plan. And without that engagement, even the most brilliant treatment in the world is just destined to fail. So we'll end with a question for everybody, whether you're a patient or a healthcare provider. Now that we know the quality of the conversation can literally be the difference between a treatment that works and one that doesn't, will your next conversation at the doctor's office be any different? The evidence suggests it absolutely should be. Thanks so much for joining us.